Using a predictive model to screen for diabetes. Hello, my name is Sophia Colon. This presentation was prepared for HAP 671 Healthcare Databases of the Health Informatics program at George Mason University. According to the CDC, 23% of adults in the United States are undiagnosed with diabetes. It is important to screen for diabetes using the medical history of the patient as presented in the electronic health record because it identifies at-risk individuals, leads to individualized treatment, and aids in preventing complications. The patient data we are working with today is from Kaiser Permanente's U.S. regions. The number of unique patients is 142,292 after the data was cleaned by removing duplicated data, erroneous patients due to incorrect date of birth or date of death. Simply put, diabetes is a chronic health condition that affects how your body turns food into energy. It's an endocrine disorder encompassing type 1 and type 2 variations and can give rise to a range of complications from kidney complications to ophthalmic complications. A comprehensive set of ICD-9 classification diagnoses were used to predict the presence of diabetes or the risk of diabetes. 3,122 is the total number of diagnoses for which we had at least 29 observations. These are examples of obvious predictions or obvious diagnoses that will occur with diabetes or have the word diabetes in their name but were not used as the definition of diabetes. Here are 10 rare diseases that are predictive but occur more than 29 times. Here are some examples of 10 most predictive diagnoses that are not so obvious. As you can see here, some involve hypertension and chronic kidney disease. Naive Bayes is used to estimate the overall risk for diabetes by leveraging aggregate data from individual diagnoses. It can provide valuable insights and reasonably accurate risk assessments. Here we have a specific case example of a patient with 5 diagnoses. Review here our corresponding likelihood ratios and calculated odds of diabetes. 20% of the data was set aside for cross-validation. The receiver operating curve plots sensitivity and 1 minus specificity observed at different cutoff points. The benefit of using predictive models to screen for diabetes helps us identify at-risk individuals, develop individual treatment, and avoid potential complications.